Okay, hello, and welcome to our fourth COVID-19 Town Hall webinar. I'm so glad that you could join us today, and I really hope that these webinars have been helpful for you so far. My name is Heather Romano. I'm the Managing Director of HR and Training here at iVET360. Our goal with these webinars is really just to provide you with the most up-to-date and industry-specific information that we can to help practices get through this really unprecedented situation in your practice. So let's get started. Today, we actually have a marketing manager, senior marketing manager, Kate Goudschaal, on the line with us. She is going to be going through marketing and communication during the COVID-19 crisis. And then after that, I will be going through updates to the CARES and FFCRA Act, and then FFCRA eligibility examples. We're getting a lot of questions about specific cases, so we tried to wrap those up as much as we could to give you some examples that might speak to situations that you have at your practice. And then we'll talk about dealing with emotional clients, which is another huge issue that's kind of being overlooked in our industry right now. And then, as usual, we'll have some frequently asked questions with me at the end. Now, we are going to be answering a lot of frequently asked questions throughout the webinar. We have answered most of the questions that were submitted in the registration process in our prior webinars. So here we're going to have a few more that came in more recently, but we are going to be focusing more on some of the questions that the iVET360 HR and training team are asked the most. In addition, we have one of our HR and training managers, Tamisha, manning the questions feed, as well as Drew, our managing director of marketing. You are welcome to ask questions as we go through the presentation about HR topics or topics related to the marketing material here as well, and they will answer as many as they can get through. Please be sure you ask questions in the questions tab of your control panel instead of raising your hand, because we won't see any raised hands. We likely won't be able to answer all of your questions, but we are going to do our best. So I am going to hand things over to Kate to discuss the key things you should be thinking about during this crisis from a marketing standpoint.
Thanks, Heather. Hello, thanks for joining us. Like Heather said, my name is Kate Goudschaal. I am a senior marketing manager with iVET360. I've been on board with iVET360 for a little over 3 years, but have more than 10 years experience in marketing communication, many of which in the veterinary industry. So I'm happy to share some best practices with you guys today. We're going to be talking about various best practices and thoughts on marketing and communication during a crisis, and specifically the COVID-19 crisis, which we're all right in the thick of right now. The first topic that we have on here is really adapting to imposed limitations or restrictions on business operations. This is a unique situation that we're all in, and that there's a lot of imposed limitations on how you guys are operating your practices on a daily basis. This is varying wildly across the country. There are some instances in hospitals that I work with that have had to shut down completely because of local government restrictions. There are others that have simply restricted contact with clients versus some that have been forced to do urgent or emergency care only and have had to forego regular wellness. So the first rule in kind of dealing with this crisis across the board is make sure that you're in full compliance with your local and federal mandates, whatever those may be specific to your area. We have heard of instances of hospitals reported for violating local mandates, and the last thing that we want to happen is to put anybody's health at risk and also jeopardize the reputation or the well-being of your practice in the long run. Another thing that you want to make sure that you're thinking about right now as well is understanding how these limitations or restrictions are affecting consumer behavior. So likely your clients are shying away from coming in for regular wellness exams or wellness care. You may find that your clients are also nervous or worried about their own health and safety and want to know what you're doing specifically in your practice to keep them safe while you're caring for their pets. Some clients may be looking for opportunities to receive care and services for their pets without even stepping foot into your practice. So these are all things that we need to think about from a marketing and communication standpoint, is how the world has changed and how that's affecting consumer behavior. Likely you guys have seen seen this evidence across all advertising on television these days, is that brands are really shifting to how consumers are reacting to this crisis. For you guys specifically, likely you've moved to limited contact or hands-free client interactions in your hospital. And if you haven't already, you should be, and I imagine that most of you have already. A lot of those limited contact practices are including curbside care, curbside pickup, or what many hospitals are lovingly referring to as vet valet, offering drop-off appointments where clients can actually literally drop off a pet, leave the premise, arrange a time to come back later on and pick them up after services are completed. Definitely make sure that right now, in addition to that, you're offering curbside delivery of prescription diet and medications. It's a revenue stream that we want to make sure that you're maintaining through the hospital, and also doing it in a way that's safe for your clients and your staff. Online pharmacy, this is a little bit of a debated topic, but if you don't have an online option for clients to purchase medication and prescription diets from you, this is a good time to really consider it and make that part of your regular service delivery and service option for clients. There is a lot of question often with online pharmacies of eroding margins and losing revenue to those, but in the long run, you're going to lose more revenue to online discount pharmacy retailers like Chewy.com or 1-800-PetMeds. So being able to keep a small portion of that revenue with the practice is ideal. And in the long run, your clients can set up regularly occurring auto ship prescriptions that keep their pets healthy, which is better for you and better for their pets in the long run. Another option that a lot of practices are looking at right now is telemedicine or teletriage. Again, this is sort of a debated topic, I think, in the veterinary industry, but it's something that's in extreme demand right now and is really gaining a lot of traction as a result of the coronavirus pandemic. So this is a way that your practice can offer remote pet care options for clients where they can get telemedicine services or teletriage from the comfort and specifically from the safety of their own home. There's a lot of options out there for telemedicine services right now, specific veterinary industry and not the veterinary industry. So I encourage you guys to do some research. Consider factors that's going to be best for your practice, like accessibility. Is it app-based, web-based? The monthly cost. If the service connects directly to your veterinarians, or if it utilizes third-party veterinary professionals outside of your practicing hours. Also make sure that whatever option you choose, it's following the VCPR regulations. Even with the kind of ease of those restrictions in many states, you want to make sure that that's something that your telemedicine is complying with. Some hospitals have opted not to go with a company. Some are doing it on their own, just in the interim as something that they can offer during this crisis. And they're doing it through common conferencing applications like Skype or WhatsApp or even Google. So there's a lot of options out there for you guys to consider. One thing when you're adapting to this crisis, you want to make sure that you're providing timely and reliable updates to your clients. And the number one thing you need is communicate those changes operations across all of your digital platforms. And this may seem like a no-brainer, but you might be surprised at how few veterinary hospitals actually maintain their digital online. Most hospitals, upwards of 90%, have a claimed and verified business listing through Google, but whether or not they're actually maintaining that is not always the case, and it's critically important, especially in a time of crisis. So you want to make sure that you are updating your business listing across all of the major digital platforms, which usually is Google, Yelp, Facebook, Bing, and now Nextdoor. You want to make sure that you're communicating your changes in operating hours. If you've reduced hours on Saturdays, or if you've even expanded hours on Saturdays to make your care more accessible, you want to make sure that you're changing that across your business listings. You want to make sure that you're indicating service adjustments if you're offering some services but not others. For example, if you've put a hold on grooming and boarding, you want to make sure that you are indicating that across your business listings. There are also special advisory alert features that have been built in for both Google and Yelp right now, where you can actually create an advisory that's front and center that pops up for clients and prospective clients when they're searching for you online, that will give them the exact information they need regarding specific COVID-19 adjustments that you've made to your business. Another thing you want to do is update your website. So by and large, business listings are generally the first place that folks go when they want to find information about your business. We all know that Google is the #1 search engine in the world. The second place they're going to go is likely your website. If they want to dive in a little bit further and find out specifically what your COVID-19 protocols are, they want to know what you're doing to keep them safe. They want to know the services that you're still providing for their pets and how they can consume those services during this crisis. So your website is your largest marketing tool. You want to make sure that you're not only updating business listings, but everything across the website as well. I recommend adding a banner alert or a pop-up notification on your website. So again, something that's going to give them information front and center about the service changes and updates that you're currently doing in your practice. Recommend adding a coronavirus updates page or a blog post that you're updating continually as the situation changes. This is a really dynamic situation. We saw a lot of changes early on in terms of shifting to curbside care, reducing hours, things of that nature. So if you have a centralized location on your website where you can provide these content updates, that's ideal, because then you can direct folks to that information from other social or digital platforms. You want to make sure, if you haven't already, that you're checking out the iVET360 COVID-19 resources page. There's a lot of really good information in there, not only from an HR and training and finance perspective, but also from marketing. A lot of client communication content that update and make unique to your practice and add to your website and social channels. You want to also make sure that you're keeping your clients updated and informed in the most direct and informative way possible. And one of the ways you can do that is through client newsletters. So you may be able to send client newsletters through your practice management software systems, through your reminder platform. If you don't have that capability, we recommend sending an email to your active clients to make sure that you're included all of your COVID-19 updated protocols. So whether that be curbside, adjusted business hours, changes in your service structure, also direct links to download a telemedicine app if that's applicable to you, or directing them to your online pharmacy. You want to make sure that you are making this information as easily accessible and digestible for your clients as possible. The last thing that you want to do is create an additional barrier for clients to get your services outside of the imposed barriers that are already being put on for you from the COVID-19 crisis. If you don't have the ability to email your clients through a practice management software system or a reminder platform, there are free services out there that you guys can utilize that will allow you to send mass emails to your clients. Two of those are MailChimp, which you may have heard of, and Benchmark is another one as well, that both offer free versions of their service for sending mass email communication. Another thing that you want to keep in mind as well is that when you send client emails, when you can, send them from a verified domain address. So for example, hello@animalmedicalcenterofxyz.com. So that is going to guarantee that you have a better chance of avoiding spam filters than, for example, if you're sending from an XYZ animal hospital at gmail.com or Yahoo or any of those other third-party email providers. You also want to make sure that you are utilizing your reminder platform. If you have it, it is a really great tool to be able to reach out to your clients with immediate communication and additional information for your adjusted protocol. So a tip here is to adjust your text or email reminder that goes out ahead of client appointments with a reminder for curbside appointment protocols. If you have a phone number at your practice where clients can text you, include it here. If it's just the regular phone number, make sure you're including it here as well and encouraging clients to call you when they arrive so that they can implement that curbside protocol. So again, just reminding clients and getting in front of them as much as you can to make sure that you're clearly communicating how things have changed in your practice. Another tip that you can do is for social media. You can also share all of your updated service protocols on your social media channels. One really great tool from Google that is free is Google Post. So this allows you to add additional information about your business on your Google My Business listing, or the knowledge panel that happens or that pops up when folks Google your hospital. This is a free service from Google. They've also added, in addition to this, a special COVID-19 advisory alert. So the combination of the two is really getting that information out in front of your clients and prospective clients at no additional cost to you. These are both free services. Another thing that we hear a lot is how to engage clients and consumers in times of uncertainty. So again, we're in a novel situation with this crisis. And one of the main things that you want to be sure that you're doing when you're communicating and engaging clients is you don't want to be tone deaf. You don't want to come across as being opportunistic in terms of a crisis, and you want to make sure that you are mindful of how this crisis has impacted your clients. This is probably one of the biggest challenges for practices in terms of continuing active engagement with clients and consumers via your social media channels. So one of the things that you want to do is make sure that you're double checking your scheduled or automated social posts that are going out. And this is actually applicable to email communications as well, which I forgot prior. But if you have vendors with regularly, whether it be your online pharmacy or other vendors that have access to your client list, you want to make sure that you know when those emails are going out and that you're creating your responses appropriately, and also to make sure that those communications that have been pre-scheduled weeks or months ago are still appropriate for the situation that we're in. And the same is going to go here for your social media engagement as well. You want to make sure that you're adjusting your messaging or rescheduling those posts completely as if they're no longer appropriate or applicable. You also want to make sure that whatever you're posting, it makes sense for the climate that we're in. And again, it's being mindful of how the crisis is impacting your clients. You want to inject yourself into the dialogue or communication in a way that's unnatural, or again, seems like you're becoming opportunistic. So you also want to look at creating engaging posts, right, that are relative to the current state of affairs. For example, again, on our COVID-19 site, we do have the top 10 pet care tips, which take just 10 minutes. This is a really great, really easy way to share 10 tips for interacting with your pets at home. So it includes things like tips for pet massage, baking pet treats, positive reinforcement, things like that. You can actually split this up into 10 different posts. And now you have 10 engaging posts that you can schedule out over the course of the next couple of weeks. You also want to make sure that when you're engaging clients that you're easing back into regular client communication. Likely for the last 4 to 6 weeks, it's been all coronavirus all the time, and that's really been the bulk of your communication. We're at an interesting point now where we can start easing back into regular client communication and education content that we're kind of calling bridge communication at this point. So you're still acknowledging where we are in the current coronavirus crisis, but we're also looking at opportunities to bring clients back into that fold and start getting back on the wagon in terms of our regular compliance communication. So now would be a good time to consider sending out one of those bridge communications, something that reiterates your curbside or your coronavirus protocol, but also is bringing in the importance of flea and tick and heartworm preventative as we head into spring and summer warmer months. You can also talk about the importance of vaccine protocols and making sure that new puppies and new kittens that are adopted during this crisis are starting off on the right paw, so to speak, with vaccine schedules and wellness exams. So again, we're sort of marrying coronavirus curbside protocol content with easing back into our regular client education and compliance. Another tip would be to identify clients at this point who are non-compliant. There's going to be a good portion of clients who are falling out of compliance over the last 4 to 6 weeks for things like core vaccines and parasite preventative. So identifying them in your system and sending them targeted communication, stressing the importance of these services for the health and well-being of not only of their pets, but of the local pet population, is another opportunity for a bridge email and to encourage folks to make those appointments and come back into the practice. Again, you want to make sure that you're identifying updated protocols and making clients feel safe with the fact that you're cleaning the hospital, using social distancing measures and all of those other things that's going to make them feel comfortable with coming in for service. Another thing that you can think about doing is incorporating positive stories into your hospital's social media strategy. So by and large, the most engaging content that comes across your social media platform are the fun stories from inside the hospital, right? Fun patient stories, photos of puppies and kittens, celebrating birthdays and anniversaries, and recognizing staff and doctors and client features. All of that stuff is what is the most engaging and what your followers are looking to when they're coming to your social media pages. In a crisis, this is a great time to continue that, but also incorporating positive stories that you may be coming across in your hospital. So if your particular practice is having a positive impact on the community, share it here. Did you donate your PPE or a ventilator that your practice have to a local human healthcare outlet? Share it. Encourage your clients to know that your practice is having a positive impact on the community. I've heard of hospitals delivering medication to elderly or homebound clients or for elderly pets. This is a great thing to share as well. Some hospitals are offering discounted daycare or boarding services for first responders or healthcare workers. This is another option, a really great opportunity to share it. This is not, I know you may be thinking that this could be borderline opportunistic, but really, as long as you're sharing the information and talking about something that your hospital has done that's positive in the community, while not trying to tag on a, hey, come in and get a free first exam, but making sure that you're really just sharing that positive story, it's a great time for it. People are really hungry for stories that make us laugh, make us smile, and really just kind of feel warm and fuzzy on the inside. Another thing too, and you guys have probably heard this, but your clients are very aware right now of the impact that this crisis is having on local business, small business, specifically your animal hospital. So they're probably asking how they can help. Don't lie, don't be honest, be transparent. If you have ways that your current clients can help, let them know. And if that means promoting your referral program, you can offer special discounts or bonus perk items for clients that prepay on their accounts. So if you have a client base and you offer to have them pay $200 prepay on their account, maybe you're giving them an extra $20 off or so, or a nail trim or something to that effect. You can also encourage clients to purchase hospital gift cards for friends and family. So this is a way to get revenue into the practice right now while your regular appointment schedules are down. One of the biggest questions, I think, from a marketing perspective that we're hearing right now is really what should we be doing for marketing? And crisis or not, one of the biggest questions or the biggest concerns that we hear at iVET360 in terms of marketing is, what is that silver bullet? What is the one thing that I can do from marketing that's going to guarantee me revenue and new clients year after year? And the reality is, no matter what climate we're in, there is no silver bullet. So what we really rely on at iVET360 is a systematic approach, and really implementing best practices and a bunch of different little pieces, some of which we talked about today, that are really going to make the hospital successful. And we look at it from a holistic perspective as well. So one of the biggest recommendations that we have in this time is just avoiding those knee-jerk reactions. I think in times of stress, especially financial stress, the first thing that a lot of practices are thinking about right now is to cut all unnecessary costs. But it certainly is not a time right now to cut all of your marketing. But it is a time to think about what marketing channels are the most appropriate and what works, and to be able to adjust accordingly. We know that hands down, digital advertising has a much higher return on investment than traditional print advertising. So perhaps this is an opportunity for you to really focus on digital advertising while maybe considering adjusting some of the budget that you've put for print advertising, knowing that that's not necessarily going to give you the biggest return on investment. If you are currently running a new client offer, like a free first exam or a $25 first exam or something to that effect, you want to continue that. You want to make sure that that is still going on, because believe it or not, we're finding that with some practices across the country, we still are seeing new client growth even during this time of crisis. So if you have a differentiator at your hospital that is important to consumers in this market, for example, you have extended hours, you offer curbside care, you offer telemedicine. These are differentiators that potentially could bring you new clients from an area where other competitors in the area are either shutting their doors, reducing hours, or don't have the service structure to be able to provide these services to clients. So definitely keep those new client offers running. One thing that you want to do in a crisis is definitely audit your current marketing campaigns. You want to know what is being the most successful and what's giving you the best return on investment. So you want to utilize different things that can help you track conversions and new client opportunities. Landing pages, utilizing Google Analytics and call tracking tools will allow you to evaluate your true new client opportunities and your return on investment. This is something that is kind of at the foundation of what we do in marketing at iVET360, is we are very data driven, and we utilize various tools to tell us exactly how many new client opportunities are coming to you from various marketing channels. This is the best way to determine where to spend your marketing dollars. And it's something that we really hang our hats on, and it's a best practice for you no matter what marketing strategy you have right now. If you have the ability to track it, you want to make sure you do that, because that's going to give you a better idea, especially in this climate, of what is the most effective and what you want to be spending your marketing dollars on right now. And if you haven't already, really take advantage of iVET360. We are offering 3 free months at COVID-19 resource page, and this is a really great opportunity to take a deeper dive into your hospital performance metrics and really understand the overall health of your business, which from a marketing perspective is really important. You want to make sure that the marketing that you're doing is working and it's getting you the revenue and new client growth that you're looking for in your practice. And finally, the last thing that we want to do, as the dust is starting to settle, we're starting to potentially see a little bit of light at the end of the tunnel. We want to evaluate the response to this crisis and prepare for the future. If there's one thing that coronavirus has taught us, is that practices need to be really nimble, especially in times of crisis. If you didn't have the ability to adapt early on to curbside service, the ability to take payments over the phone, an online pharmacy or telemedicine, if you didn't have these tools in place, you likely found it harder to adapt to this changing market over the last 6 weeks. So evaluate how your practice responded and identify deficiencies that limited your adaptability, right? So if we're looking at tools that really should be implemented in a practice, one of the #1 things we're looking at is a reminder platform and compliance tracking. And not only having that system, but having a client or adoption user rate that's 40% or higher. If you have a reminder platform and you don't have your clients using it and engaged on it, then you're not reaching them. So you need at least 40% of your client base on that platform. Another thing to look at too is your ability to email and text clients for those immediate and reliable communications. Do you have client emails in your system, and do you have 70% or more of those in your system with valid email addresses? This is key. This is how you're going to be able to reach out to them quickly in a time of crisis. Do you have an online pharmacy? or do you have telemedicine capabilities? These are two things that maybe are not as ubiquitous across the industry, but are really important, especially in times of crisis. And these are likely things that are going to benefit your practice in the long run, outside of coronavirus. Other things to consider too is, do you have the ability to take client payment, not only over the phone, but do you have client payment options? Have you partnered with payment plan options like Care Credit or Scratch Pay? Do you offer affordable wellness plans, or a way for clients to stretch out the annual costs of healthcare over the course of 12 months? If you have these options, these are going to be really strong differentiators for you in the coming months as we transition out of coronavirus, right? So being able to really market to existing clients and new clients that you have ways for them to be able to pay for pet care in times of financial crisis that they're experiencing, that's going to be a differentiator for you. Other requests. Can your request easily? And do you claim an business listings, right? We talked about this. Just having it actually created is not enough. You need to have quick access. You need to be able to update those business listings and make sure that you're communicating that to clients. Do you have the ability to quickly edit your website? Or do you have a connection with your current web or marketing provider to be able to reach out to them and have them make edits to your website within 24 hours? That is crucial. Do you have consistent social media presence? Do you have a positive place where you can send alert, update, change protocols? Lastly, do you have the ability to know if they are giving you a true return on investment? So as we head out of coronavirus, we're thinking about preparing for the future, right? So we're still in the very thick of it. We're still in our short-term solutions. So continue to think about those things that are happening within the current crisis. Continue with your curbside protocols. Continue with being able to provide service to clients and patients while keeping them healthy and keeping them safe. As we round the corner of this, we want to start thinking about midterm and long-term solutions as well, right? So a midterm solution, likely for most practices, is going to be really focusing on compliance, making sure that those clients that fell out of compliance within the last 4 to 6 weeks, that you're easily reaching out to them, back on care. In the long term, we're going to look at solutions that are more around operational deficiency. So some of those things we talked about. Do you have agile marketing campaigns? Do you have some of these tools that we talked about in the previous slide that are going to help you be a more stable and productive practice in the long run? Definitely keep us in mind and stay tuned. We are going to have an in-depth marketing your practice and sort of this post-COVID-19 consumer landscape webinar that's going to be coming online from our marketing department here pretty soon. But in the meantime, if you have any questions about kind of what we talked about today, or really want to know up industry benchmarks and your marketing, we're happy to answer that for you. So you can send us any questions you have regarding crisis communication, communicating and marketing during COVID-19, anything of that nature. Feel free to pop us an email at marketing@iVET360.com, and we'd be happy to answer that for you.
Thank you so much for your help with this today, Kate. That was fantastic. Now let's go ahead and jump into some human resources stuff. First, a quick reminder, anyone who has any additional questions about marketing can continue to ask them in the questions bar in the control panel. We have marketing managers available to answer as many as we can before the end of the webinar. So let's get started with some FFCRA updates. Now, because the language in the FFCRA was very vague, there have been really more questions than answers about many key policies in the Act. The Department of Labor has been putting out exhaustive lists of questions and answers to try to give businesses the information they need to make the best possible decisions. But there are so many questions and answers, it's really difficult for the average business owner to A, find time to go through all of them, and B, comprehend what all of those mean to their practice. So we've gone through these hundreds of questions that they've answered, and we've pulled out a few items that should be of particular importance to veterinary practices. So the first one is seeking a diagnosis or told to stay home. So in the FFCRA, it says that if somebody is sick and they are either seeking a diagnosis or they were told by a medical professional to stay home, then they qualify for the sick leave portion of the FFCRA. All this means is that the employee needs to tell the hospital the name of the doctor or governing body issuing a quarantine order. They do not necessarily need a note from the doctor like they would with typical FMLA. They only need to provide a statement that's signed by the employee that states the employee's name, the date for which leave is requested, the coronavirus qualifying reason for leave, and a statement that the employee can't work or telework because of this reason. And then it's not on here, but the other two things that they should have is if they are sick or taking care of somebody who's sick and have been told not to come to work, they need to give you the name of the doctor or individual or governing body who told them that. You don't need to follow up with it or anything. You just need that name in case you get audited in the future. And if they are taking time off to care for a child or children who are out of daycare or school, they just need to provide you with a copy of the notification that they received from that daycare or the school. That's really all that you need. So this means that your tax documentation for paid time off towards tax credits should be a lot easier for you, since getting doctor's notes and all of that is just so hard right now. Next, if you've asked an employee to stay home pending the results of a family member, this employee is likely eligible for FFCRA sick leave. Now, if you pay them for this time, then it will count against the 2 weeks or 80 hours allowed by the law. So this means that if in the future that same employee contracts COVID-19 themselves, you can pay them only for hours up to 80 when combined with what was paid when you asked them to take that leave. Now, we've received so many questions about layoffs that occurred prior to March 1st and how that affects FFCRA pay. When the FFCRA was kind of in the middle of being passed, we had a lot of people who were trying to lay individuals off to avoid having to pay that money to those employees. However, the Department of Labor has come out with some guidance about this and has stated that if your hospital laid off or otherwise terminated someone on or after March 1st, that person is still considered an eligible employee for FFCRA time. So specifically, if the employee was laid off or otherwise terminated on or after March 1st, and then you rehire them anytime before or on December 31st of 2020, provided that person had been on your payroll for 30 or more of the 60 calendar days prior to the date of the layoff, they are eligible for FFCRA pay. So that means that if they get sick while they are out, if they get COVID-19 or if they have another qualifying reason, you still owe them that FFCRA pay. So it appears that this is relating more to the Expanded Family Medical Leave Act than the Emergency Paid Sick Leave Act, but they have not confirmed that yet. And so the best practice would be to go ahead and make sure that if you have laid somebody off or furloughed them before or on March 1st or since March 1st, if you're going to hire them back by the end of the year and they get sick or they need the paid childcare time, that you go ahead and pay that to prevent being fined in the future. A lot of individuals have told us that they don't want to do this necessarily because it ends up costing more money. But we always ask, was this person a valuable individual in your practice? And almost invariably, the answer is yes. And so this is going to be a really small price to pay for rehiring your valued team members in the future. Next, hospitals and employees can choose to, quote, top off their EFMLA pay. So this means that they can choose to use saved paid time off time to make up for the 1/3 of their pay that they will be missing while they're on emergency family leave. Now, you as an employer may not force team members to take accrued PTO, so it has to be chosen by them, but you can offer it to them. You can say, you're only getting 2/3 of your pay. You have 3 weeks of saved PTO. Do you want me to top off that extra third of your pay using your banked PTO? The individual employee is completely allowed to say no, but it could give you the option to drain their PTO accounts if that's something that would be helpful to them. And then finally, exemptions are one of the most commonly asked questions we have received since the FFCRA was passed. Now, as we've noted several times, the majority of veterinary hospitals are not going to qualify for an exemption. There's a very small segment of the private business world that's going to qualify for these. We estimate that only practices with fewer than 5 employees are going to qualify. And this is mainly because in order to qualify, you have to prove that your hospital would pay more in payroll due to FFCRA payments than it would make in revenue. So to put that as plainly as possible, that means that if you are going to be paying $10,000 this month in FFCRA payments, your revenue would have to be less than $10,000, which very, very few hospitals are going to meet that benchmark. So for hospitals that do believe that you're exempt, if you are fairly positive that you're exempt, you should consider whether you're exempt on a case-by-case basis, not as we as a hospital are exempt. This kind of echoes our stance that you have to be ready to defend yourself if you decide that you are exempt, because employees are going to be able to file claims with the Department of Labor, and the Department of Labor is going to be aggressively following up on these claims. So instead of saying to your employees, we as a hospital are completely exempt, you can take it on a case-by-case basis. So if you have a small practice, less than 5 employees, and your only veterinary technician needs to take emergency family leave to care for their child, you could say, well, I don't have any more technicians. I cannot run my hospital without this individual, period, end of story. However, if you've got 3 receptionists and one of them wants to take time, you could not make that person part of the exemption. So hopefully that makes sense. Let us know if it doesn't. We are recommending that all hospitals, with the possible exception of those with less than 5 employees, just go ahead and assume that all of your employees are eligible for FFCRA time. The cost of defending against these claims is going to be overwhelming, and the guess right now is that most businesses that believe they're exempt are not going to win those suits when those employees bring those claims up. So the cost of defending this is going to be overwhelming, and the pay that you have to pay out is going to be reimbursable through tax credits. So it's not going to have as large of an impact on your practice as everybody thought it was going to back in mid-March when they were first talking about all of this. So next, I want to jump into some FFCRA eligibility examples. Now, we have gotten a lot of questions from our client hospitals asking whether a specific employee is eligible for FFCRA pay. However, almost all of these specific examples are frequently asked. So we hear very similar situations over and over and over again. So obviously, I can't go over all of the eligibility questions here in this webinar, but I wanted to go over a few of the most common ones we hear, as it might help guide you with some of your own employee eligibility situations. So the first one is the employee has chosen on her own not to come in because her mom, who lives with her, is a cancer patient and she is afraid of exposing her. The employee has no pre-existing health conditions and is not symptomatic. Now, this employee is only going to be eligible for FFCRA pay if she brings a signed statement that she signs noting the name of the doctor who told her not to come in. Now, if she cannot provide this, then she is not eligible. Now, Something that I have heard a lot is, well, they could literally Google the name of a doctor in our area and write that person's name down. And you are absolutely correct. They completely can do that. We are going to have to give people the benefit of the doubt. We're finding, though, that the vast majority of employees in animal hospitals are really hesitant to lie about this. So we have not seen a whole lot of situations where an employee has blatantly lied and said some random doctor who doesn't even practice general medicine, a dermatologist told them not to come in or something like that. Pretty much we've seen that across the board, people are being very honest about the doctors' names that are telling them not to come in. The second one here is the employee has been feeling ill with a fever and flu-like symptoms. She has not been able to get in to see her doctor and will not be able to be tested. You have asked her not to come to the practice until she is feeling better. This employee, or any situation like this, would be eligible for FFCRA pay because she is assumed to be infected with COVID-19. So there's a little bit of verbiage in there that says, if they are sick or if they are assumed to have COVID-19 and they're seeking a medical diagnosis, then they are eligible. But if they are sick and you do not want them in the hospital, then they would still be eligible for FFCRA pay. The next one, employee felt ill in March and stayed home. The hospital paid the employee for 2 weeks, which was before the April 1st activation of the FFCRA. Now we're in April and the employee is now sick again, and her symptoms are more consistent with COVID-19 than her last ones. Her doctor told her not to return to work, but can't get her tested because of a lack of tests. This employee is eligible for FFCRA pay because the FFCRA is not retroactive. So that means that an employee took unpaid time in March, you don't have to pay them back pay. However, it also means that even if you did pay them for time off in March, you still have to pay them for FFCRA pay if they need to take time off after March 1st. So it's kind of this bittersweet thing, kind of good and bad at the same time. The next one, employee tested positive for COVID-19 on March 28th. She ended up being out for 2 full weeks, but only 60 hours of those 2 weeks were in April. So how should we pay this employee? This employee is eligible for FFCRA pay, but only for the 60 hours that she took in April. So as I just mentioned, the FFCRA is not retroactive. So if you had somebody who was saddling both months, you only have to pay them for time that they took starting on April 1st, and you do not have to pay for any time that was taken in the month of March. Now, if you want to, if you're a particularly generous practice owner or practice manager, there's nothing stopping you from doing so, but from a legal standpoint, you are only required to pay for what has been taken in April forwards. And then the last one here, in February, all of my team member hours were reduced via furlough from 40 hours per week to 30 hours per week. They maintain their full-time status. 2 of my employees have just tested positive for COVID-19. Do I have to pay these employees 80 hours each? The answer is no. Those employees are only required to be paid for the hours they would have worked had they not been sick. So if the schedule was already created, then you can pay them based on the hours that they would have worked. Now, if you had not already created a schedule, then you're going to need to take an average number of the hours the person has worked over the last 6 months. So if you can prove that you put out a schedule the day before or even a few days before these people went out up to that point, you can absolutely not pay, or you can absolutely pay them for the current hours that they're working, so the 30 hours per week. But if you did not create a schedule, or if one of your supervisors didn't quite get it out in time, you are going to have to make an average of the number of hours that they've worked over the last 6 months. Now, we've talked a lot about the CARES Act in the last 2 webinars. Unfortunately, the rollout of the small business assistance programs outlined in this act have been really troublesome, to say the least. We are getting reports of banks not able to process applications, banks refusing to help hospitals, hospitals getting approvals only to later be told that they will receive only a fraction of the approved loan amount, and much more. In addition, there is much confusion both in the government, the banking sector, and in small businesses about the Paycheck Protection Plan, how it works, and exactly what documentation is going to be needed. Now, unfortunately, we don't have the answers for you here, but we are working on it. Our sources are in the same boat as your financial advisors and bankers. There is just not enough information right now to confidently answer questions about how and when funding is going to be available, how forgiveness is going to work, and what documentation is going to be needed. So we are working really hard on getting more information, but in the meantime, we're recommending the following. First, be in constant contact with your bank. Keep those lines of communication open. If you have a loan agent you are working with, try to contact them as often as you can, but at least every other day or so. You're going to annoy your loan agent, I promise you. But making sure that you are getting updates will help you be able to react as appropriate when things start to come down the funnel. Because funding is coming from the banks, they are going to have answers for you far before anyone else will. Second, because the loan amounts are uncertain right now, we are highly recommending operating, at least in the near term, as though there will never be any funds from the SBA Paycheck Protection Plan. Even though if you made an application, you likely will obtain some funds, it does not make sense to return to normal operating staffing levels until you have absolute confirmation that this money is coming. So you can bring your staffing levels back to normal once you have this confirmation. This way, you're not going to be putting your practice into a perilous financial situation. And really, in the worst case scenario, the interest on these loans, if they're not forgiven, is a really negligible 1%. So even if you can't bring your staff back in time, or if you bring them back way too late, the financial impact of the interest will not be really overwhelming for you. So let's talk about dealing with highly emotional clients. We are hearing this a lot from animal hospitals right now, and practices are really struggling with this more so than they struggled with this during the last recession. Now, clients are extremely emotional right now. Some are very, very financially insecure. Some of them are dealing with family issues, like being trapped in the house with their entire family. Some of them are dealing with sick family members or even grieving the loss of family members or friends. And some are just uncertain or afraid of the future. Now, we have heard of practices really struggling with this. These emotional situations from these clients are going to create some very difficult situations. Some of the things that we have heard about is dealing with hyper emotional clients. And when I say that, I mean people who are bursting out at employees for no reason whatsoever over something completely trivial. Also, dealing with clients blaming them for their pet's illness. We're seeing hospitals dealing with clients blaming the team for their own inability to afford care for their pets. We've heard a lot of employees having to deal with aggressive clients, both on the phone and in person. And worst of all, we have heard of clients actually threatening the team. The worst we actually have heard is clients posting photos of themselves pointing a gun while ranting in Yelp reviews. So this is becoming really serious and we need to start addressing it. Now, this isn't new, obviously. I mean, veterinary hospitals have been dealing with angry, emotional clients since the industry began. However, the team may not be used to how angry or emotional these clients are now, or how frequently this happens. So this means they're going to need some guidance from you, the practice leaders, to help them understand how to deal with these situations. Now, we've been recommending to our practices the following. First of all, we recommend that you empower the team to make the best decision for the client. Many hospitals are giving their team members a small budget they can use for discounts and other incentives for clients to try to help calm them down. This can help some clients who are upset about something seemingly minor calm down a little bit, but it can also allow the staff a little bit of leeway for very, very financially insecure clients. We also recommend that the team help the client understand. That you help the team understand the client and why the client may behave this way. Oftentimes the team misunderstands why clients lash out and take their outbursts really personally. And so it can help them to understand the reasons why clients become angry and why they should not take it personally. Now, if you are a learningvet.com subscriber, or if you are an iVET360 client and therefore by default a LearningVet subscriber, one of the courses that's available to your team is Managing Angry Clients, which gives a deep dive into why clients become angry and how we can better deal with them. If you don't have a subscription, there's going to be an email address up on the screen in just a moment here. Send me an email and we can get you signed up for a 3-day trial. So then you want to give them some tools. So first, we want to thank them for their feedback. Whenever you have an angry client in front of you, you want to say, I really appreciate you giving me this information, telling me this, etc. And a lot of times that alone will help the client calm down. The client usually just wants to feel heard. So tell your team to thank the client for their feedback, even when it really hurt. Next, they should try to use the word because. There's been a lot of research, a lot of psychological research into how using the word because can actually help to calm somebody down because it forces their brain to see reason again. So if your team is trying to explain something to a client in an appropriate way, if they say, we did this because, or this happened because, sometimes that can also help calm the client down. And then they should also always ask questions and then listen to the answer. When you ask an angry client questions, it forces their brain to step back from their anger for a moment and think about a solution. And so sometimes doing that can help bring their rational brain back. So even if it's the employee saying, I want to make sure that I understand this, I'm going to repeat this back to you, and then saying whatever the synopsis is, and then saying, did I miss anything? Or is that correct? Or do I have this right? Even something like that can help disarm a client a little bit. Next. Oh, I'm sorry, this is all duplicate here. Look at that. So next, connect with the client. So they should try to pick up on what the person needs. So do they need more hand-holding? Do they just need an apology? Sometimes an angry client just needs to hear somebody say, you know what, I'm really sorry. We messed this up. We're gonna fix it for you. Sometimes that's all they need. Or do you need to mirror their energy or their personality? The more your team can connect with an angry client, the more they're going to calm down. So try to give them some of those tools. Finally, you can give the team a few things not to say. So there are triggers that can take an angry client and send them straight through the roof. So these statements can include things like, I understand how you feel. Nobody understands how any other human being feels. People take this as very, very condescending, and it will send somebody way far off the deep end. Other examples are, that wasn't me, or any other kind of blame shifting, or saying, oh, well, that was Nancy who did that, or I didn't take your call, so I don't know what you're talking about. Also saying, that's not our protocol, I don't make the rules. That's a huge problem too. Whenever you have an angry client, none of them care about your protocols. They want to know how you're going to fix whatever's making them angry. So tell your employees, tell your team members that that's our protocol, or I don't make the rules, should not be in their vocabulary at all. So I mentioned a little bit earlier about a trial for learningvet.com. So if you would like to check out the Managing Angry Clients course, and through this you can also check out all the other courses that are available on there, just send an email to hello@learningvet.com and we will get you all set up. We'll send you an email back asking for some specific information and some email address information, and then we'll get you set up with a 3-day trial. So for our last little section here, question and answers with Heather, not Tamisha. So these are actually some of the most commonly asked questions that our HR and training team is dealing with right now. These are the ones that we are answering pretty much every day. So the first one is, my employee is sick, but not COVID sick. Are they eligible for FFCRA pay? The answer is no. The only illness that qualifies for FFCRA pay is COVID-19 or suspected COVID-19. An employee who is sick but does not have coronavirus can still take unpaid sick time, or they can use accrued PTO as usual, but you do not have to provide the emergency paid sick leave for them. Question 2, I had to cut my employees' hours, but they want to use PTO to cover those hours. Can I prevent them from doing so? In general, yes, you can. The Fair Labor Standards Act does not mandate paid time off or make any rules about it. However, this can vary from state to state. So if any of you are from, say, California or Illinois or New York State, these states all have specific restrictions on how you can and cannot pay out and restrict PTO usage in your practice. So you want to make sure that you know the laws in your state or even in your city. So for example, San Francisco has its own PTO requirements. So make sure that you are very, very aware of the laws. If you're not very, very aware of the laws, you may not want to limit. Now, you also may not want to limit because some employees may not be able to pay their rent or their mortgage or their groceries. So if you cut somebody's hours by 20% and that's going to make a homeless person out of the situation, that's probably an exception that you may want to make. So in general, what I say is if you have to cut all of your employees' hours, say if somebody is heavily struggling financially, come and talk to me and we'll see what we can do on a case-by-case basis. The vast majority of your team members will not come and approach you. But I always recommend hospital owners and managers remember that your team members are usually poorer than some of your poorest clients. And so in order to prevent them from losing their home or not being able to buy groceries for their kids, you might need to make a couple of small exceptions and allow them to use PTO. Next, I have split my teams. How do I pay them? So we're getting a lot of questions of, well, because I split my teams, they're only working half of the hours that they're supposed to. So do I have to pay them for all of their normal hours? You do not. So the Fair Labor Standards Act says that you only need to pay employees for the actual hours that they work. Now, what we're recommending is doing a furlough so that they can collect supplemental unemployment. So that means that if you have taken your employees who usually work 5 days a week and you've cut them down to 2 days a week, you tell them that they are furloughed for 3 days every week until the end of the COVID crisis. And that way they can collect unemployment. So they will apply for unemployment if you give them a letter stating that they've been furloughed for 3 days per week or however many days per week your hospital is furloughing them, then they can submit that along with their unemployment claim and hopefully get that approved a little bit faster. Now, salaried employees, such as managers, should be placed on furlough for full days that they do not work. So if a practice manager or a doctor, even if your doctors are salaried, do any work on a given day, even just check their emails, that individual by law has to be paid for the entire day, even if they only did 5 minutes of work. So make sure that you furlough them for full days they don't work, so no half days or anything like that. And it should be the same number of hours per week. So you can furlough them for 8 hours per week or 10 hours per week or 20 per week. Just make sure that you're not having them work half days because they have to actually get paid for the full day if they do any work on a given day. Question 4, my employee may have been exposed but is not sick. And we're hearing this a lot. And this has been a really hard one because there's been a lot of conflicting information from the Department of Health and the CDC about what exactly we should be doing. And on top of that, each individual county also has its own recommendations here. So the first thing that I'm telling all hospitals is do not punish the spouses or family members of emergency room or healthcare workers. We're getting this question a lot where my technician's husband works as an emergency room technician or an emergency room nurse or an emergency room janitor. I don't want them in the hospital. But really that is punishing the families of the individuals who are working to save the lives of Americans. So I do not recommend punishing spouses and family members of anyone who is working in an at-risk field. Now, fortunately, the current CDC guidelines are if somebody has been exposed, so that means if they have been living with somebody who is working in a high-risk job, such as working in an emergency room, or if they have spent time with somebody who may have been sick, but they don't live with that person, they can continue to work as long as they are asymptomatic. This is a huge change because for a while they said, if you even think you've been exposed, do not go to work. But I believe that the reason that they're kind of backing off of this is the assumption that the vast majority of people at this point have actually been exposed and either were completely asymptomatic or had symptoms so mild that it was taken to be allergies or a minor cold or something like that. So on the other hand, if an employee lives with someone who is sick, you may want to place them on leave. So if one of your technicians' husbands comes down with COVID-19 or one of their kids comes down with COVID-19, then yes, you may want to place them on leave because odds are if they weren't a carrier before, they likely are a carrier now. Now, other exposures, like I said, any non-same household exposures to sick individuals should be able to continue to work per the CDC. So for the last couple questions here, EFMLA situations. So question 1, is it better for an employee financially to go on emergency family medical leave due to childcare or to be laid off and collect unemployment with the CARES Act additional $600? It's possible. They may be financially better off to do that. It's really going to depend on the specific employee. If you have a well-paid employee, usually unemployment is only a fraction of their pay. And so that extra $600 is not going to make up for the amount of money that they're going to be losing. So if that's the case, what we recommend is furloughing them instead of laying off if the intent is to rehire. You can also say to your team, we need to do some furloughs or some layoffs. Do we have anybody who would like to volunteer for this? And tell them to come talk to you within the next 48 hours or something along those lines. And that way, individuals who maybe aren't in such a difficult financial situation, they can choose to take a furlough instead of having everybody take a furlough. But for individuals who have to go on EFMLA, it's really going to be up to you and that employee whether it makes sense to furlough them and collect unemployment, or if it makes more sense for them to collect their EFMLA funding at 2/3 of their salary. Question, the CARES Act says that the first 2 weeks of the EFMLA can be unpaid. Does this mean 14 working days or calendar days? It means calendar days. So if it is, Sunday through Saturday, for example, would be 7 calendar days. So they only need to be paid or unpaid for the first 2 weeks, not the first 14 days of work. Can an employee work if she is available while she is on EFMLA? And yes, the emergency family leave can be taken intermittently. So your team members can come into the hospital for full days if they're available. If they're not salaried, they can also come into the hospital and take a half day of the EFMLA. Keep in mind that if they take the EFMLA intermittently, that means that it will be stretched out just like regular FMLA. So they can take it over the course of much longer of a time until they make up all of the hours they would have taken if they took it in one lump sum. So the last 2 questions here. Question 7, how can I fill my team fill their time when things are slow? Number 1, online training. So there's learningvet.com, there's @Dove, there's TED Talks, etc. If you're bringing your team members back to the hospital to be in compliance with the payroll protection plan, these are things that you can have them doing to use up some of the time that you are paying them for, so they're not just standing around drinking coffee and talking to each other. There's always deep cleaning. When I was managing hospitals, I always used to tell my team there is always something to do. So that can be, taking everything out of the drawer, cleaning everything, cleaning out the drawer and putting it all back in there. It could be cleaning out the deep freeze. It could be taking the air vents off or the vent covers off of the air ducts and cleaning those and sending a vacuum hose up there. It can include client database cleanup, lost client calls. You can do CPR drills. Really anything you can do to educate your team will only make them stronger employees later. And then there's equipment maintenance. I'm sure that your lab equipment would very much appreciate a full maintenance and perhaps a cleaning. And then also landscaping. a lot of times our landscaping gets a little bit neglected, especially if we don't pay a landscaper to come out and do it. So there's nothing wrong with buying some flowers and having the team paint or plant them. They can also paint the hospital. That's another really popular one that we're seeing hospitals do, where they buy a few cans of paint and the team members who aren't busy with patients are painting the hospital. Inside the hospital, we don't really recommend having them paint the outside of the hospital just for safety's sake. And then the last question, when is this going to end? And this was my favorite question that came through. So hopefully you're on the line because this question kind of made me smile a little bit. Unfortunately, I can't say when this is all going to end, and I'm sorry about that, but it is going to end, and we are getting closer to the end with every single day that goes by. The nice thing is that the veterinary field, believe it or not, no matter how difficult you might be finding it right now, we are faring far, far better than other industries. I mean, so many retail establishments have had to close, and so many restaurants have had to close. So many service industry participants have had to close. And so the fact that we have been able to, for the most part, stay open on some scale is actually really good, and it's going to help us to recover much faster. On top of that, I want you to remember that your team loves what they do and they really want to help. They really want to do everything that they can to help the practice keep going and make sure that nobody loses their job. So keep in mind that we are all in this together, the entire industry, and we here at iVET360 are here to help in any way that we can. We're going to continue doing these webinars for the rest of April. We're going to have a couple of additional webinars that we're going to be scheduling in April. One of them is going to be marketing, and then another one's going to be a what's next after COVID, so that we can start planning for how to recover as soon as all of these restrictions are over. So we are here to help in any way that we can. Please reach out to us if there's anything that we can do, but just hang in there. We're going to get there, we're going to get through it, and we're going to come out on the other side ahead. So thank you so much for attending our town hall. The next one is going to be scheduled for Thursday, April 23rd at 10 a.m. Make sure you stay tuned to our COVID resource website at covid19.ivet360.com, and then visit ivet360.com/HR to sign up for additional HR support regarding COVID-19. Thank you all so much for joining us today. I really appreciate you taking the time to spend your afternoon with us. I hope that you all stay safe and stay healthy. We'll talk to you next time.